My name is Dr. Richard Hilsden. I am a general surgeon, and I want to talk to you today about the risks of hernia surgery. Now, specifically, we're going to talk about groin hernia surgery, as there are many different kinds of hernia operations that myself and other abdominal wall surgeons do. Now, hernia surgery is extremely safe. And again, if you're contemplating surgery, talk to your surgeon about the risks. That's the person that can give you the best information for your situation. If you're one of my patients and we're doing a groin hernia, I want to say thank you. Thank you for following me on the website. Thank you for trusting me with your hernia repair. And as with all things in healthcare and all things in medicine, we work together to create a good outcome and for healing. But I think it's a good idea for you to have a good understanding of what risks are associated with hernia surgery. It's incredibly safe, one of the most common operations done in North America, and we provide a ton of benefit to people when we operate on symptomatic hernias. But like any operation, there are some risks. They're small, but you should be aware of them. And I'm going to talk about the most common risks today. So probably the most common and most important risk that we talk about is the risk of pain associated with the hernia repair. Now, with any surgery, there's going to be some discomfort after that. Tylenol, Advil, or acetaminophen, ibuprofen are all you really need to do to treat the pain after hernia repair. But there's a small percentage, maybe about 1 out of 100 hernia operations, where people get some pain from the nerves in that area. And that can lead to some chronic discomfort and some challenges managing the pain going forward. It's rare, and there are multiple things that we can do to try to reduce the likelihood of that and to actually treat it if that were to occur. But that's probably the most important risk. For men, there's a small risk of testicle loss. Again, that's about 1 in 100 cases. Typically, the very large hernias, the ones that have been out for a long time, those hernias are the ones that are at highest risk for testicle loss. But it is a risk that we all need to be aware of. Very commonly, patients will get an area of numbness in the thigh after hernia surgery. And if you're a female patient, that's almost 100% based on how we do the hernia repair. For a male patient, that's also relatively high, and you need to be prepared for that. Most patients don't notice this area of numbness, and it'd be only aware to them if we evaluated them, but it's really important for you to understand that that's also a risk. There's a small risk of bleeding, small risk of wound infection. Again, wound infection is about 1 in 100. When I do groin hernia repairs, I almost always use a mesh. And there's an enormous amount of controversy out in the community right now based on mesh repairs. In my hands and in my experience, that provides the best balance of reduction of the chances of recurrence, as well as the safety profile. That being said, it is a foreign material, and some people can have some discomfort from the mesh. Some people can have complications related to the mesh. But again, these are extremely small. These are less than 1% risks. And again, if I'm doing a hernia repair, that is the technique that I'm going to want to offer you, because I believe that's going to give you the most durable repair. Beyond that, there are small risks of anesthetic. Again, in my hands, we typically do groin hernia repairs under general anesthetics, but there are opportunities to do it under local or other types of anesthetic if that's what you would prefer or what your surgeon can offer you. Beyond that, swelling, some, like I said, discomfort. Some people will find the first few days difficult to walk around and do the regular activities. These are the normal things that we would expect with surgery. Again, hernia surgery is safe. There are a number of risks that I can't describe here, but these are the general ones that you need to be aware of. And again, if you're trusting me to do your hernia repair, I just want to say thank you. And it's a journey that we're going to go on together.